Hey folks, Dr. McCarthy here, and today we're going to discuss a little bit about fibromyalgia. If you've been following us along on Facebook and on the website, you know that we've got an upcoming workshop here in the office. So I just want to give a little bit of information to the folks who are coming, or those folks who are wondering whether this is going to be worth their while. One of the things that we talk about with all of our folks who come in here who have been diagnosed with fibromyalgia is blood sugar regulation. And most folks think, well, I don't have a blood sugar problem because my doctor never said I had diabetes. And yes, diabetes is a problem, but that's not what we're talking about here. What we mean by regulation is maintaining normal, healthy blood sugar levels throughout the day. Never getting too high, never getting too low. What we see with most folks who are dealing with fibromyalgia or any kind of other chronic health problem is that they are dealing with this blood sugar roller coaster. Throughout the day, you wake up, you're hypoglycemic, you'll eat something, you get insulin resistant, and you don't eat for a couple hours, you get hypoglycemic, insulin resistant, and as you go on this blood sugar roller coaster, this creates a whole bunch of different issues. One, when you don't have a steady supply of blood glucose, it affects your brain function. So if your brain's not functioning properly, do you think that can contribute to your fibromyalgia symptoms? Absolutely. Most of the folks who come in here talk about brain fog. If you're not getting a constant, steady supply of glucose to the brain, that's brain fog. Secondly, is when you have these surges of blood glucose, your body tries to respond by giving you surges of insulin. And insulin can affect all kinds of different hormones, and it can knock your hormones out of whack. Do you think that could be an issue with fibromyalgia? Absolutely. Probably hasn't been evaluated. They just give you some pills, Lyrica or whatever it might be. Nextly, when you've got this blood sugar dysregulation, your brain will scream down to your adrenal glands, your stress glands on top of your kidneys. And the response is a cortisol release. And cortisol will help to regulate your blood sugar, but that's only supposed to happen in times of extreme stress, not 4 or 5 times a day, every day. This affects your hippocampus in your brain, memory, focus, and concentration. And when cortisol gets released, we also see a release of epinephrine and norepinephrine from the adrenal glands. This affects your type C nerve fibers, your free nerve endings, and you feel pain all over because you've got these chemicals surging through your system. So it's really important, if you've been diagnosed with fibromyalgia, to have your blood sugar evaluated properly by someone who knows what they're doing. That's what we do here in our office. Hopefully this information is valuable to you, and if you like it, go ahead and share it with other folks, and feel free to contact our office at any time, ask us any questions. I look forward to helping you. Thank you.